So let's start our conversation out with talking about total body water. Total body water, simply put, is the amount of water in your body. And it gets estimated based off of your weight. Now, there are certain things that will either make that weight estimation be either higher or lower. Now, total body water is largely, or the body water in your body is largely located in your lean muscle. So for that reason, there are some things that will affect the percentage of your body weight that is made up of water. That includes your sex. So overall, men have a higher percentage of their body weight that is water compared to females. For that reason, whenever we estimate total body water, we usually say that men have about 50 to 60% of their body weight as total body water. And this actually roughly comes out, or does come out to, 0.5 liters per kilogram to 0.6 liters per kilogram. This is going to come back and haunt you in the next slide when we talk about the calculations. And in females, we actually estimated at 45 to 50%. And that would mean that that's 0.45 liters per kilogram to 0.5 liters per kilogram. So you can see here that a larger percentage is in male of the male body weight is made up of water compared to females. Similarly, age. As we get older, as you can see here, your total body water actually decreases as a percentage of your total body weight, with as children having like an 86% versus once you get into the elderly population, it gets much lower. So as we increase in age, we have a decrease in total body water. Then we have weight. So if patients are obese or overweight, they typically have lower percentage of their total body weight that is made of total body water because a lower percentage of their body weight is made up of lean muscles. And then finally, you have nutritional status. Patients that don't get enough protein or have poor nutrition typically will have a lower percentage of their total body weight that is made up of water. So they have lower total body water. Now, I want you guys to think about this because you just learned about this. What other thing in our body is actually or what other value that you guys typically will have to calculate is actually affected by the amount of lean muscle in their body, or something else that has a similar proportion whenever we think about all these different aspects? Some of you guys might be thinking, oh, this is just like serum creatinine, and that's true because serum creatinine is largely associated with lean muscle. So is total body water. So that might just help you guys remember all these different factors. Now, whenever we calculate total body water, for ease of use, I suggest that you guys use the 0.6 liters per kilogram in male and 0.5 liters per kilogram in females. And then so all you're going to have to do is take the actual body weight times 0.6 or actual body weight times 0.5. Now, I'm having you guys use actual body weight because that's what I use most typically in my clinical practice, unless in certain specific circumstances. However, many other people in clinical practice will use the lower end of these spectrums, because remember this was supposed to be 0.5 to 0.6 or 0.4 to 0.5, 0.45 to 0.5. So they may use the lower end of these in obese patients or even use ideal body weight in order to overcome the lower percentages overall. So that's just something to keep in mind. So let's do an example calculation. So it says calculate a total body water for a 60 kilogram female. So let's go back to our equation. So for females, total body water equals actual weight in kilograms times 0.5. So we're going to just take the actual body weight times 0.5 liters per kilogram, and that gives us 30 liters. And that's our total body water. You can see this is a pretty simple equation. So let's do another one. So let's say we're going to do a 70 kilogram male. As I already mentioned, the equation for total body water for males, I'll just put an M here to remind you, equals 70 kilograms times 0.6, because this is your actual body weight times 0.6 liters per kilogram. So what you should come up with here is about 42 liters per kilogram. And that's the total body water. So you guys are going to be expected to be able to do this equation. Once again, I do not give you these percentages in your equation sheet, so you do need to memorize them, or those like conversion factors. Now, the next thing you might be wondering is, where does all this body water go? Because, I mean, you probably don't feel like you're mostly made of water. So, when we talk about total body water, once again, depending on your sex, that usually ranges between 45 to 60% of your body weight, right? And when we think about that, about 1/3 of that is located in the extracellular fluid, and about 2/3 of that is located in the intracellular fluid. So the majority, so this is like a little like example here of an idea of what this. So 2/3 of this total body water is in the intracellular fluid versus extracellular fluid that's only 1/3. Now that extracellular fluid can actually be divided into a couple different sections. Number one, you have your interstitial fluid, and then you have your intravascular fluid. So interstitial fluid would be this fluid that's in between these cells. And that's about 4/5 of this area here. So versus about 1/4 of this extracellular fluid, or fluid outside the cell, is actually located in the vasculature or in blood cells. This is going to play an important role, this actual percentages here, whenever we talk about crystalloids versus colloids. But just think about this. So if I had, for example, that 60-kilogram female that we had in our example problem, about 30 liters of body water is in her, right? That's what we calculate as their total body water. In that 30 liters of total body water, you have about 20 liters that is in the intercellular fluid. Then you have about 10 liters that's in the extracellular fluid, right? And then out of that 10 liters, 8 is in between the cells in the interstitial fluid. And then only 2 liters, 2 measly liters, is actually in the vasculature. I mean, that's pretty amazing.